So
Okay.
why don't I just begin? Well, good morning, everyone. I'm Mcfarlane. I'm the editor of Insight News and have the fortune of not hosting, but moderating the regular monthly meeting of the Northside Urban Coalition. You have the agenda. Let me go through it with you. This is presented by Hawthorne Neighborhood Council. Today is August 21. And this meeting's theme is, as always, we're done talking. Now let's do the walking. Only a team can make a difference. And we are dedicated in trying to see how we can work together during the COVID-19 crisis, the opioid crisis. How do we make a difference for our community? I want to begin by acknowledging Representative Foley, thanking him for his leadership and his service and for his presence. Our objective here is to share with each other and with our community and with the public our feelings, our thoughts, our data, our analyses, so that we document where we are with the intent of continuing to create a catalog of how we have built and changed our neighborhoods and our families and city for the better. Let me ask Diana to welcome everyone to the meeting. First of all, Diana Hawkins, good morning, and thank you for making this happen.
Morning, everyone, and thanks for joining us for our monthly meeting. And as always, thank you, Al, for moderating. Today, we have some dynamite topics that are coming up, and as always, it's good to have Representative Foley here with us. You know, it's good when you can get your elected leaders to come out and join in the conversation on a monthly basis. I'm going to jump right in and let everybody know that from today up until October the 31st, we are doing our winter warmth collection. And with that, we are also collecting school supplies. And we know that families are struggling right now. So even though the kids are not going to school, they're still going to need pencils, papers. So we're doing a collection as usual. And we're going to do our winter coat collection as well. So you can contact our office at 612-529-6033, or you can drop off a donation there, and it must be new. We will have a giveaway in November, so look for monthly updates coming on that. And with that being said, I am going to turn it over to Mr. Andrew to get the meeting started.
Hey, thanks, Diana. Yeah, so I'm going to start by talking about our grant that we received and the grant project that we have going on. As you all are aware, we received a $1,000 grant earlier this year and have been working on implementing our plan, which was to create a coloring book for our youth that would be, the actual pages would contain people and locations in our community that are important places for healing, places to go when you're in crisis, places to go when you're struggling with trauma, that are all productive and are alternatives, positive alternatives to what we see often as a way of dealing with trauma and stress, which is drug use or alcohol use. And so we've been working on that. We had some hiccups just finding artists. And actually, Diana and I last week, we found one and it was really great. And then we just could not agree on a financial scheme for it. And so that kind of fell apart. We were so close. But after that, what I've done is some more research, and I've actually found a company that you send in photos, you upload photos, and then they actually have a team of artists that take those and turn them into line drawings. So it doesn't have the romance of having a local artist or a group of local artists doing the actual work, but it's the same thing in the end. We get to have the same concept and have those important places. So I'll be working on that, getting actual nice photos of the places we're going to include in the book, and then actually creating that book. What I am asking of this group today is I need a few people, or all of you, or whoever can volunteer to do this, to just come up with, we need, a couple hashtags for in the book. So we need to, just like we have our tagline of, we're done talking, now we're doing the walking, we're doing the work. Something that can go in the book that's focused towards youth to make sure they understand if they're in trauma or in a crisis, these are locations they can go to. And also, maybe even a title, or just a paragraph that we include in the beginning of the book about the mission of this organization and why we're producing this project. So if anyone on this call is willing to do that or wants to be a part of that, please email me and we can team up and get that done. It really shouldn't take much effort at all. If a few of us get together and just brainstorm, I think we can get that done in a day or so. So that is it from me. I'll turn it back to you, Diana.
Actually, we're going to go to Mr. Al. He's going to take it from here.
Well, let me thank you so much. Thanks for the update, Andrew. And let's go on to Representative Foley. Thanks again for being here, Representative. Would you give us an update on what's happening at the legislature in general and what's happening with our community in particular? Things you want us to look out for, to support, to watch out for, to fight against, but general update on how we stay engaged as a community.
Well, thank you all for having me on for this coalition meeting. I really appreciate the opportunity to provide some update about what's been going on over at the Capitol. And so we were just in session about a week ago, just a little bit over a week ago. We didn't really pass anything substantial this month because this is the month where our Department of Management and Budget we're going to sell bonds for the state of Minnesota for public infrastructure projects. And so we did not want to mess around with any of the state's finances. We had to have like what they call a gray period and not having any financial transactions so that we could go to the market and actually sell bonds for projects that we have done in the past. And so that was a quick one-day session for us in the Minnesota House. And then we are expecting to be called back into session again in September. And this is where we will need to hear from neighbors on the north side. One of the issues, remaining issues from the legislature is to pass a critical public infrastructure bill. And, within the House bonding proposal that we have in the past, we have a few projects that are critical to the north side. Specifically, one of the controversial ones that I'm hearing will be for funding of the Upper Harbor Terminal. We have that. The city of Minneapolis had a request for Central City stormwater for our water infrastructure. And then on the north side, we had in our bill funding for the 26th Avenue connection so that we on the north side have connection to the Mississippi River and to the rest of the bike and park and system in the city of Minneapolis and connecting to other parts of bike system, trail system in throughout the metro area. We also had some funding in there for North Commons Park to help with what they're reimagining over there. And then some of the equity projects that we have on the north side, including the bill, was to help fund some of the work that Juxtaposition is doing with regards to expanding their campus to serve the people of the north side and throughout the state. And also we have some money in there for the Baldwin Square project with Jamel Ford and his crew on a little bit north of Hawthorne right now, up here on 42nd and Fremont. And so these are just some of the critical projects that we have in place that we still love to hear from folks on our north side on if you have any thoughts on these projects. And then before, I believe, the last time that I was on this conversation, we were going in to vote on police accountability and reform. And so I just want to inform community members right now that, public safety it remains one of our big issues. And we were able to work with, the Senate to come up with a proposal that include, some of these issues here. Let me just read it out. We had some investigatory reform. We had some police residency reform to allow for incentives for the city of Minneapolis and the city of St. Paul to hire folks within the community. Looking at post-war reform and having some citizen engagement in there, prohibiting war-style training, banning chokeholds and certain neck restraints. And so those are just some of the measures that we were able to work with our Republican colleagues in the Senate on to really move forward, as a result of the George Floyd situation. And so there's some remaining work for us at the legislature. And Right now is a critical time for us to be engaged. As many of you may know on here, the Met Council has gone back onto the board to really rethink where possibly can they work the blue line, the Bahano Blue Light Rail line, where right now, uh, over the last several years, they have not been able to work with Burlington North Santa Fe, the railroad company, to allow for use of their railroad track next to Deer Wharf Park and next to the north side here. And so the county, Hennepin County, and the Met Council is looking at alternative routes to having the blue line now. And so I think it's critical for all of us, for folks who do support or don't support LRT transit to make their voices heard. On my end, I really support this decision to really look at this and see how could we get light rail to service the north side. And so I'll be doing my part to push my colleagues, at all levels of government to really see what can we do to get more transit here on the north side. And so I think I would just leave it at that. And if folks have any specific questions around other issues, feel free to let me know. But do know that even though we're not in session, we still have a lot of work, and we'll be continuing some of this conversation as we move forward throughout the end of the year.
Great. Thank you, Representative Lee. Any comments or questions right away? I have a couple that you might want to respond to. Just to the sake of information and your point of view, can you give us a distinction in how the legislature is approaching the question of police accountability and reform that compared to what we were hearing and responding to from the Minneapolis City Council? And my sense is that a lot of the members of the coalition and neighborhood organizations are not so supportive of the actions being initiated by city council members because they felt those things are being done without the consent, the engagement, et cetera. So what's your description of how these considerations are the same and where the differences are between the legislative approach and the city's proposed charter amendment strategy?
So for us at the state level, like some of the provisions that I have mentioned, we really want to look at more of systemic, changes to law enforcement accountability and reform. And so that's why, this past session, there weren't any bill introduced to, let's say, to defund the police or any of that. And, that's something that, our local electeds here in the city of Minneapolis are having that conversation on. And I do want to make it known that at the state level, we are not having those conversations. We really want to see how could we make systemic changes to law enforcement accountability. Like arbitration reform, where just I think this past week where we have the officers at the 4th precinct who were terminated because of the posting the Christmas trees with some of the insensitive materials on there, and now they're back on because of the arbitration process. And so there's some progress for us to make, and so that our local electeds and our chiefs, so that they have the ability to really go through the process, and if they deem that they need to terminate someone, that it actually won't stand. And so we're making some progress on that, and not to the extent that our city council member have said around, oh, we need to defund the police or any of that.
Okay, great. Quick note about update on the state's response, and we're going to talk about it with Sarah in a minute, but on COVID-19, what is our community doing from your vantage point to respond to the challenges, both for individual health and also the economic impact of the shutdown of the economy behind COVID-19? And the same thing comes too with the other pandemic, and that is the reaction to the George Floyd murder.
Yep. So thank you for that. So regarding response to the pandemic and the George Floyd situation, I believe I mentioned this when I was here in July, that we at the state level are still trying to figure out what can we get and do to provide some kind of financial support for local businesses on the north side and throughout the city of Minneapolis, throughout the metro area. Unfortunately, we weren't able to do anything in August that has anything to do with budgets. And so we're just waiting for the month to turn over into September so that we could, actually start to get to work after Labor Day. And so please stay tuned. I think it's critical for us to provide support to businesses and community members who are impacted by the civil unrest. And we have made a commitment in the Minnesota House that, we understand that statewide there are disasters right now, but we cannot provide any kind of support to the rest of the state and leave Minneapolis behind, leave the residents of North Minneapolis behind because of the civil unrest that was out of our control. And so do know that you have the commitment of myself and my colleagues to address some of the disasters that we have seen in our community first before we will make any significant movement on anything else. And yesterday, I had a conversation with the Minnesota Department of Health. I believe they are working with New Salem to do some additional testing for the community coming up here. I'm not sure if it's this weekend yet or coming up.
I think it's the 28th, I think, or something. Yeah. It's next week probably.
And so so I have shared my concern with to the department that right now on the department's website there's only 3 testing sites on the north side over at North Point, North Market, and then over at the North Memorial Clinic on Weber Parkway. And so there's only 3 sites. And, that's, when we're seeing all these disparities in our communities, especially in our Black communities, indigenous communities of color, we need to ensure that we have more locations and more testing sites that are free, that, does not create a barrier for our community. And so they have acknowledged that need. And so that's why we're having that on the 28th, and then I'll continue to push. If there's any interest in doing additional testing, near the Hawthorne area or south of the district for me, let me know so that I can engage with the Department of Health to see what can we do to get more testing sites.
Great, thank you so much. Any other questions?
I just have a quick comment to make. The Minnesota Black, not Minnesota Black, but the Black Nurses Rock have been working to help to create some new testing sites. I think New Salem is going to be a testing site. So there are things that are going on. I just we'll talk more with the Hawthorne neighborhood about it so that we can get more sites. But there are people out here working to get more sites here in North Minneapolis.
Thank you, Clarence Jones. Any other comments or questions of Representative Fuley? Okay, hearing none, I want to thank you again, Representative, for being available and for your service to your constituents and to our city, to our communities, and just applause. Keep on doing a good job. Thank you so much. Let's move on the agenda and call on Bill Magnuson to give us an update on the question of police activity, violence in Hawthorne, Jordan neighborhoods. Bill, good morning. How you doing?
Al, before we go to Bill, can we go to Sarah because she has to leave?
Oh, that's right. Yeah. Okay, let's do it. Bill, do you mind?
Yeah, we're going to go to Sarah and then Clarence.
Okay, great. Sarah, then Clarence. Go ahead, Sarah.
So I was just here. Did you have any questions for me, or do you just want me to talk about what we're doing?
Just an update on what you all are doing at North Point, and sort of update on COVID-19. Do you have statistics on how many people in North Minneapolis are being impacted directly by the COVID-19, by coronavirus?
I don't have statistics specific to the north side. I know what we're doing here at North Point is that we have testing. We have testing by appointment. When you call in for an appointment, and it's open to the public, it's open to everybody. It's open Monday through Friday. When you call in, they'll get you set up. We have both drive up and walk up options. So when you call to get set up, we get you scheduled at, we have 2 locations where we're doing testing depending on where you get scheduled. I know that we've seen over 5,000.
What are the 2 locations? What are the 2 locations?
We don't share the locations because we want to get you set up with an appointment. You go to the right location.
Okay.
I will say we have one on Broadway and then one on Plymouth. So they're kind of throughout the community, and we try to get you to the one closest to you or what matches with your means of transportation. Sure. And I will definitely say that we are seeing higher rates than what you see at the state level. For North Point, we're open to the public. So that means that we're not just serving North Minneapolis, we're serving anybody that can come to us. I will say what I do know is that our positivity testing rate is right around 20%, and that we've tested over 5,000 people at this point. And so we're definitely seeing that COVID continues to touch our community. I mean, we do know that a lot of who we serve is North Minneapolis. And so I think that's definitely important to listen to. I believe, don't quote me, and to be clear, I'm a community engagement coordinator, not a doctor. But the state level is significantly lower than what we're seeing here at North Point. And so I do think it's fair to say to people, just remember it's really impacting our community at a rate higher than other communities. And part of that is because we have a lot of people here who are essential workers, a lot of people who take Metro Transit, a lot of people who live in, crowded housing and have intergenerational family living, and just all the different pieces that can provide you more exposure. And so we just really encourage people to remember to continue to do the basics. Wear a mask whenever you're out and about. Stay 6 feet apart from people that don't live in your household. Wash your hands. And those are really the big things. The other thing that I would say that we have is we've really tried to change. We try to make our services accessible, but make them more safe for people. So for instance, when you come to the clinic now, when you have an appointment, we have people screening you at the front desk when you come in. We ask that you come in with a mask. If you don't have one, then we provide one for you. If you we ask that only the person with the appointment comes in, because we want to just limit the amount of people in. And so we're just really making sure that you're safe when you're in the clinic. We still have our food shelf operating. I actually just left for produce distribution. We're actually partnering with Wells Fargo, Second Harvest Heartland. The Urban League has given us their parking lot for the produce distribution. Mad Dads is there supporting us, helping us box up food. And what we're doing is we're boxing up food. We have free produce, fresh produce, meat, dairy, and shelf-stable like canned goods. And we load them into people's cars for them. When I left this morning, there was a line down the block. So we still have 2 more of those. We have one on September 11th and then one on September 25th. We still have our food shelf that's open Monday through Thursday from 10 a.m. to 4 p.m. And that's on Penn and Golden Valley. And that is open to the community. We pre-box food so that you can stay safe and really limit your exposure. And then the other thing to remind people about is this is really stressful time for people. And North Point has behavioral health services available where you can call in. You don't have to come in. You can literally call in, make an appointment with a therapist. There's so many stressors going on. People are spending a lot more time with their families than normal, or in their houses than normal. Domestic situations are increasing, and there's stress and just the anxiety of just being exposed to COVID, and people experiencing anxiety and stress. People are experiencing lower income. And so we want to make sure that you know that our behavioral health services are there and able to support you. And it's just about helping you deal with that anxiety and stress. And to get connected really with any of our services, you can call 612-543-2500. And we just want to remind people that we're still here to help you. We're still here to serve you. Definitely call before you come, because we want to make sure that you get served. But we just want the community to know that we're here to help.
For people that want to get the food that's being distributed today, you sign up for that? Do you have to show ID when you get there? How's it organized?
So I would say, you don't show, all we ask, there's no pre-registration. All that we ask is that we just ask you the number in your household. So I would say it's while supplies last. So it started at 10, it's 11:30 now. We have capacity to serve 350 families. I don't know if it's still going today. I don't know if they're done for today, but the next September 11th and September 25th, people just show up at 10 a.m. And like I said, we only ask you the number in your household so that we can make sure you get the amount of food for you.
Okay, awesome. All right, any questions or comments? And if not, Clarence, why don't you jump in and talk about the priorities for your work and organization? And thank you for being here.
I want to thank Diana and Andrew for the opportunity to talk about the project that we're doing. I am the community health strategist for a group that's called the Human Partnership. And we've been around for about 10 years working in community. One of the highlights of our work has been the fact that we have provided more than 100,000 free health screenings to our community, and that would be with doctors and nurses and dentists. In fact, North Point is part of the Human Partnership as well as Hawthorne. But around 2017, 2018, we were made aware that opioids was a problem in our community. Someone came to me and they said that opioids was a problem in our community, and I said, okay, I don't do opioids, so it didn't matter. I didn't think about it. I talked to one of the healthcare professionals that I work with. I said, well, we're going to be working on a project around opioids. And she said, why? Your people don't do opioids. I said, okay, I don't do opioids. But what I found out was that opioids was a big problem in our community, but we didn't call them opioids. And all of a sudden it kicked in like, oh, okay, here we go. Crack, cocaine. And it was going to be a jail for some of us, and it was going to be a medical epidemic for other folks. And so we started doing a series of lunch and learns. We started doing a series of surveys around opioid use. And what we were going to do that was going to be different was that our whole work is structured around hearing the community's voice in this project. So we started working with the University of Minnesota because we knew that we needed to collect data. We also know that we needed community connectors and collaborations in order to make this work. And we just wanted to make sure that when we went out and we talked about this issue to whoever we would talk to as a stakeholder, that they would understand not only do we have the research behind it, the academic power, but we also have the community's voice. And the community voice was the first thing that we went after. And so we've had this partnership with Hawthorne probably about 2 or 3 years now. Where we have been working on this. We've done a survey in the past with the University of Minnesota using a project that is called the Omaha System. The Omaha System is a data collection IT project that really was designed for clinicians to talk to clinicians, to talk about what the issues were so that a clinician could talk to another clinician about what it was. But they also, by working with the University of Minnesota, we worked with with Dr. Karen Munson and Robin Austin, and they had a product that was called the My Strength, My Health, which looked at issues not from a deficit aspect, but from a strength-based assets. And we knew that was the way to go. We knew that our community had strengths, but so many times people did not talk about them. And so we actually created a partnership with them to do surveys. And so we've done about 400 surveys around the state of Minnesota around the opioids and how do we describe them? Because see, for us, it's not opioids that we talk about. We talk about heroin, we talk about oxycodone. And so when you're in this conversation, people are saying, well, we don't do it, but we do it, but we just call it something different. So we had to create a product or a program that would talk about how do we translate the language so that the clinician as well as the community members could both know what we're talking about. So we have been fortunate, and we will be starting after Labor Day. We have received a grant from the city of Minneapolis to do a survey in North Minneapolis, to do 400 different surveys to see and take a look at what's going on in North Minneapolis specifically, but also how are people describing this issue. We know that there are some major issues that is occurring. I think, Sarah, you started talking about this with COVID-19, people are in their houses, but there are people in their houses that are doing opioids. You know, what is the impact of that? And so we need to figure out what that will be. So we will be doing a program, again, collecting 400 surveys, but what we are going to do that's going to be different is that we're going to have 4 different dissemination points. As we go through collecting information from the community about the community, we're going to have 4 different times where we're going to share with the community what we're learning. That way, whatever we're saying will be validated by the community. I mean, I'm not going to tell you anything that the community isn't saying. We also have community members who will be overlooking the project. So we have Diana, we have people from the university, but we also have a lot of community members that are going to be looking at that. So as we go through this, we're going to have the ability to speak clearly the issue about how people in North Minneapolis are utilizing opioids, what are they saying, but also to start taking a look at what are the strengths that we have as a community to help us to address this issue. Because I think that part of what happens is that we're not as helpless or as hopeless as people try to make us believe, or we think sometimes about ourselves. So that's what our strategy is that after this Labor Day, we're going to be into the community. And if you want any kind of information about what we're doing, all you gotta do is give me a call or even talk to Diana, because she's gonna be over the part of that steering committee that's gonna be helping us. But we want to be very transparent. And one of the things that I think that we have tried to do as a human organization has always been to be transparent. We have no hidden agendas. I want my community to be healthy, and that's all we're looking for. So we're not trying to get in anybody else's lane. We know that we do need to have a clear narrative from the community about how this issue is affecting us, and so we're going to collect that, and it will be disseminated through the Hawthorne neighborhood as well. So that's what I'd like to say.
Great, thank you so much, Clarence. Any questions or comments of Clarence or of Sarah? One thing, I'll make a statement, Clarence. I think that the approach, the idea of data-driven decision-making is critical, and that's what you're delivering to the community. And the extra value is that the data is being organized and framed by you, by us. And so our interest and our outcomes are at the center.
Yeah.
Too often in the past, when studies were done, it was them studying us, reports go on the shelf, never to be heard of again. And we admire the problems, but the problems go on and on and on. And so the difference is that when you put the power of analysis, of research, of data in our hands, I think we're presenting the possibility for real and effective, measurable change to happen. So thank you so much for that. Let's move on to.
I want to make one other comment, Kenny, and I thank you for that. But I think one of the things that makes this a little bit different is that we're working with very, very credible organizations and individuals. And so we have a long history of working in our community. And that's really what we're hoping, that people will tell us honestly how they're feeling. That's what we need more than anything else, not the game. We want to know what the real deal is.
There we go. Well, thank you so much. Bill Magnuson, thank you for being patient. Let's talk about what's happening with violence in Hawthorne and in Jordan and other issues of concern to the precinct and the community.
Thank you, Al. So I don't really have any specific numbers when it comes to stats for crime. I do know that looking at crime stats and the maps that I've run over the last 2 weeks, there is been a downturn in crime, not necessarily violent crime though, because I know that there's still shootings taking place. I do know that our department had some reorganization taking place where we directed a bunch of officers from other units into a gun violence investigation unit, and they are on the streets now investigating a lot of these assaults. Some arrests have been made on some of these past assaults and past murders. And so I think over the last 2 weeks, crime in Jordan Hawthorne has gone from double digits to high single digits. But obviously, there's still a lot of work that needs to be done to address some of the issues that we're facing as a city and the communities of Hawthorne and Jordan as well. One thing that Diana did ask me to present on is she asked me how COVID has impacted some opioid use. And so run the numbers that I just have access to. From March until the end of July, MPD has responded to 58 overdoses with opioids where Narcan has had to be used to bring the victim back to life. And over the course of 2019, Narcan was used by MPD 113 times. So in 5 months, we are more than halfway of what we used out of total of last year. So that tells me, I guess, and I saw studies and news reports that this epidemic, the pandemic, the quarantine has affected a lot of our mental health, especially in the 18 to 24 age group. And so I think that's a direct result. When you're in mental health as expected, you look for other avenues to escape. And I think that, narcotics are obviously one of those avenues that people explore, unfortunately. So those are the numbers that I came up with, and those are just ones that MPD has access to. That's not counting North Point or Hennepin medical centers too that responded to those. So I think that's impactful, and I think that obviously it's very problematic, and that we need to do a lot of work, and that's what this coalition is all about.
Okay, any questions, comments? Diana?
Just, oh,
I was gonna ask either Sarah or April if they wanted to chime in on the statistics of what Bill was saying.
I don't necessarily have the statistics, but I would be in agreement with Bill. We have harm reduction and testing services that are located at 710 West Broadway. It involves both a syringe exchange, but also we show people how to use Narcan, and people can reach out to learn about that. I was just pulling up the hours for that. The hours for that we have are Tuesday and Wednesday from 2 to 5 p.m. and Thursday through Friday from 11 a.m. to 5 p.m. And I think it's so important because what we do know is that usage has definitely not slowed down during COVID. And so we just want to make sure that the community is aware of the pieces. And I do, it does seem like chemical health and mental health go hand in hand, and that both have to be addressed. And so we just want to make sure people are getting the support that they need.
Okay. And who else did you ask to speak on that, Diana?
I believe she asked me to speak on it.
April?
Yeah, I don't know if I have a ton to add. I know that several of the different outreach teams that are out in the community have been trained. Not all of them have been trained in how to do Narcan, but some of them have. And I don't really have a ton to offer specifically about work I'm trying to lift up within the Office of Violence Prevention and within the health department, but we're working to be more trauma informed and trauma responsive. And so as that work develops, we'll be reaching out to our community organizations and neighborhood associations to be part of that as well.
Okay, great. Thank you, April. Thank you. Next,
Al, can I ask one quick question, actually? Bill?
Sure, Andrew. Sorry.
Yeah, Bill, I know in the past you've spoken about, especially with the sale of opioids or other drugs in North Minneapolis, it's an issue of suburban kids also coming in the city to purchase. With COVID, have we seen any changes with that? Is there any statistics on actually where people are coming from to purchase drugs?
No, unfortunately, I don't have any statistics. I still think that we are still getting people from the suburbs and outer areas of the metro area coming in here and, looking to purchase narcotics. But I think that the thing that we're seeing a lot more of, at least in my neighborhoods that I'm responsible for, is just local youth and local residents that are, out and about on the streets, whether they're living on the streets or not, that are, in the communities and buying the narcotics for their escape. And I think that addiction and crime go hand in hand. I think that if we can take care of addiction issues and try to solve that problem, I think crime is going to go down and homelessness is going to go down, and the communities are going to be better off as a whole. So I think it's very important that we focus on, trying to take care of addiction, and then crime is going to go down as well.
I know.
Does that answer the question, I guess? I'm not sure if it does or not.
Yeah. Thank you, Bill.
Bill, I know last time I raised the question about what's happening on my block, 1800 block of Bryant Avenue between 18th, Ascension Church on one corner, and then Broadway on the other side. And I mentioned that in the middle of the block on my side of the street, which is the west side of the street, there's a building that was burned. It's 2 doors up from me. Christmas Eve, I think, or New Year's Eve. And it's half a building now charred, and it's been sitting there for half a year, more than half a year. And two things, I don't think that would be allowed to happen in St. Louis Park or in Uptown or in Southwest Minneapolis. Why is it still there? But two, people now are congregating in that building. So my street looks like an open air drug market now. And so there are just 20, 10, 15 people hanging out and traffic in and out that I'm presuming, I'm just presuming, but it doesn't look right, doesn't feel right, it's scary. So what should be happening? And I think the property there that's not maintained is a magnet and enabler of this activity of hanging out and people not caring. So I would appreciate anything you could do to either tell the residents of the block or to look into it so that we don't have things just going, like out of control completely, which it almost is right now.
Yes, I'm very familiar with that. It was actually brought up at our MSTAT meeting on Wednesday, Al, and it's not necessarily it's my sector, but I was aware of it. I know that Tori and Rowena Holmes, my colleagues and other CPSs, that's in their sector, and that building that you're speaking of is actually now set. I think the city's taking bids on demolition, so the building is going to be demolished as a whole. And I think that one of the feelings is that that's going to assist or help out with what's plaguing the block there. But I think there's going to be more work needs to be done because I think there's an apartment complex that's directly adjacent to that is part of the problem too. And I think that our problem properties officer has been working on that. Our community response team is working on that. But I think we need some input and some backup from the property management and the owner as well on how to address some of those issues there. And I know that our crime prevention specialists over there are working to address that as well. And as far as what you say, it doesn't take place in St. Louis Park, those other ones, I couldn't agree more. I said it before and I'll say it again. I get very frustrated about the lack of buy-in, the lack of resources that the Northside seems to lack, and other entities throughout the city don't necessarily suffer that kind of lack of resources. And it's very frustrating to me, as I'm well sure it's frustrated everyone on this forum.
Well, that leads us to the next question on the agenda, and that is the encampment in tiny homes. Diane, who's going to be addressing that? Sheila?
Sheila was going to be addressing that, and she's kind of not on the call. I sent her an email, but Andrew can address a little bit about what we're trying to do with regards to, we all know evictions are coming up, and we need to be ready for that.
Yeah, actually on my laptop, I have the presentation that they gave the neighborhoods pulled up. So they're working on it. It's an indoor villages concept. And so think of almost dorm rooms that are inside of like a warehouse. So originally they were working on a plan to do this at the now vacant Kmart on Nicollet and Lake Street, in conjunction with the post office, the temporary post office that's going in there now. But now it's going to be at 1251 North Washington Avenue. So I think that's pretty much right on or very close to Plymouth and Washington. So kind of where the North Loop ends, and then we get that little warehouse area as we move up. I haven't heard if this is officially going to be implemented, but it's a transitional housing situation. It's not going to be permanent. It's really, again, just a opportunity for there to be something to get through the winter, and then hopefully find permanent housing. But I'm not one that I can really speak strongly on that. I do know with renters, it's been great that the governor's emergency declaration has continued, despite what we're seeing, Senate Republicans trying to really get rid of it and force him to end his emergency powers or force his emergency powers. And I will say though, now that we're at this month-to-month period, talking with people who really are in this role of renter assistance, it's very hard on renters to know whether or not they're going to be evicted in the next month or they're going to have one more month in their unit. Hawthorne, we're working with, we've talked with a few landlords. Our housing committee has really talked to landlords, encouraging them to do what actually a lot of the big property ownership groups are doing, which is work out a payment plan. That's going to benefit the landlord, and it's going to obviously benefit the resident, the dweller. Right now, neighborhoods, it's harder for us to actually have money that fills in those rental gaps. But there are more and more programs out there, and we have links to several of them on our website, hawthorneneighborhoodcouncil.org, where you can find out more information. And obviously Homeline is an incredible resource. So if you're a renter who's watching right now and you're not sure what's going on, Homeline has done a tremendous number of online web chats where they actually had one of their in-house attorneys talk about legalities of what's going on and what you can and can't do, what you can get evicted for right now and what you can't. And I'll tell you the list of what you can get evicted for right now is very small. You should not be getting removed from your housing right now. But yeah, as far as encampments, I think the same thing. We just need to pay attention to what the park board is saying, because we've seen some that are getting cleared out and some that are remaining. I know obviously Powderhorn has been cleared out a couple times now. St. Paul is talking about the encampment along 35E. And it's just a matter of where those people in need are going from that point. And it's something that we're very much focused on in Hawthorne as well, making sure that, one thing that in years past that's been brought up on the north side is sometimes it looks like we don't have a homeless problem because we don't get these huge encampments, right, in our parks. We don't see those type of situations. But a big reason for that is we have a lot of vacant housing that people move into. And that's when we see tragedies where maybe a fire gets started in an abandoned house. So don't be fooled that we somehow have escaped this problem on the north side. It's there, it's just more invisible. And it's something that we're very much tied into in Hawthorne and working with our community leaders on.
Okay, thank you so much. Tiny homes, what's that about? Do you know? Can someone tell me?
So, if you give me a second, Al, I'll pull up their presentation.
Mm-hmm.
And let me see if I can share that and just kind of give everyone an idea. And again, I'm not, this isn't something that I've worked on. This is just something that was presented to Diana and I. Give me 1 second.
And while you're doing that, Kirsten and Jake, either of you have something you want to share or call our attention to?
I can share a grant that is coming out from the state.
That'd be great.
It's probably going to be coming out after the holidays now or early December. The timeline is not set yet, but it is for a school district, and to be eligible, their substance use rate has to be higher than the state. And this year is the first year they're opening it up to other substances besides alcohol. And the whole concept for the grant is around positive community norms. So it's a good chunk of money for 5 years, and that school district uses these strategies to hopefully reduce the use rate of the youth in that school district.
Could organizations like the coalition partner with the district to be part of that, or what do you think?
Yep. You just have to have the data, and I can help you with that. If I don't remember, I'm pretty sure Minneapolis School District participated, but it was not a large participation rate from the schools. But I can help look into that for you guys if you are interested.
That'd be great. Okay. And Jake, any comments, thoughts, feelings, things you want to share?
Yeah, thank you, Al. I just threw in the chat box, and it started. The first 3 sessions were on Thursday this week, but they're recorded, and so I threw in the link for the National Coalition of Promise Zones inaugural federal convening, which is virtual. This was kind of thrown together rather quickly based on the Evansville Promise Zone, which has had a federal convening the last couple of years, and that's bringing together federal partners, mostly from the Chicago region, and then other local partners, mostly from Indiana. And since we're all obviously at home this year, or most of us are at home working, we thought it would be a good idea to expand the access to this event, rebrand it a little bit. There's 15 sessions spread out over 2 weeks, all recorded if you can't make them live, and an array of federal resources around promise zones, opportunity zones. We have presentations from EPA, Federal Reserve Bank of St. Louis, and more coming up in the next couple of weeks. So feel free to check that link out. There's a link in that Facebook event to the Eventbrite registration. So if you have any more questions on that, you can feel free to reach out to me, and I'm happy to answer them.
Thank you. Thank you. Andrew, did you find the information you're looking for?
Yep, let me pull it up. And hopefully you all can see this now. Let me know if you can.
Yeah, I see it.
Okay. So this is their conceptual layout for 1251 North Washington. And then you can see, let me go, if this helps. You can see the tiny home shelter concept there. So essentially little, like truly an indoor village. So these little structures, you know, like I said, I kind of compare them to a dorm room or something like that, but a personal space that will be within the building itself.
So these are all units inside. It's kind of like a storage facility, right? Or not?
Well, I think, you know, so I think in Diana, you were on the same call when they presented this, so let me know if I'm missing something. But you know, obviously it's about personal space, but also, you know, trying to just provide the social distance that we need right now. So you know, I think it's a clever idea. They're going to do a pilot program and then see where it goes from there.
Okay.
But I can, you know, I'll put this PDF up on our website, and so people can download it and take a look at it if they want to see more. Because it is. I just don't want to speak too much to it because you know, it's not something I'm involved in.
Put it in the chat as well, if you don't mind.
Okay.
Okay. All right. Anything else? Next steps. Where do we go from here? I'm going to turn it over to Diana, and you can talk about next steps and during the meeting at your pleasure, Diana.
Well, Al, you know, it's always a pleasure to have you facilitate this. And I just want everybody to know that, you know, our coalition is about the youth and helping them with the opiates. But as we are working now in a different light, we are actually really sharing a lot of information with a lot of youth that are listening into this that people really don't understand or they don't know. But we have a lot of youth that listen to this coalition meeting. So I just want everybody to know we still are reaching our youth. So that's why I ask you guys to please share with us so they will have the resources and they will know where to go to get the information. They will know where to go to, like you said, Kirsten, apply for a loan, you know. So I really, really appreciate this. Clarence, I look forward to getting out there and getting the survey started. I know that this is going to be another winner like our paper was. Representative Lee, as always, thank you. And Elle, you can have the last word.
Well, I think that's it for me. I just can't overstate the importance of us spending this time together. It's quality time, great information. And as Diana said, let's share it and keep this feeling of that we can and that we will alive in our community. Let's not be immobilized by the threats and the challenges of COVID-19 or other pandemic issues or other disparity issues, but let's rather be affirmed in our belief that we can and we will and we do make a difference, that we are co-creating a future that benefits us individually, our families, our neighbors, and our society. So with that, let's call the meeting to an end, and thanks to everyone for being on board.
Thank you. See you guys. Bye.
Bye-bye.